Hello, I'm James Morris, Fire Chief and Emergency Manager for the City of Westland. 2 years ago this month, the World Health Organization declared a global pandemic in response to COVID-19. Today, many experts believe the virus that causes COVID-19 will never be eradicated. The world must at some point transition away from pandemic and towards an endemic phase. Pandemics are a wide and rapid spread of disease with exponentially rising cases over a large area. Endemic viruses, meanwhile, are constantly present and have a fairly predictable spread. That predictability allows healthcare systems and doctors to prepare and adapt, reducing loss of life. For a pandemic to reach an endemic phase, it would need to be a situation where you have a background level of disease. This means that while some people would still get infected, it wouldn't be an unbearable number with devastating consequences that overwhelms the public hospital systems and 911 providers. Enough people will gain immune protection from vaccination and from natural infection such that there will be less transmission and much less COVID-19 related hospitalization and death, even as the virus continues to circulate. The seasonal flu or influenza is an example of an endemic virus. H1N1 influenza has had pandemic spread of variants in the past, such as the Spanish flu of 1918 and the swine flu in 2009. Variants of these are now part of the respiratory viruses that we regularly encounter. There's not a hard and fast rule when it comes to pandemics becoming an endemic. Without knowing if there may be another variant on the horizon and without a predictable pattern of disease, it's still too soon to tell if the nation has reached an endemic phase. An endemic indicator is where you are seeing consistently low numbers, the healthcare system is able to manage it, and people are able to get the care they need. With this in mind, surges or outbreaks will occasionally occur fueled by coronavirus variants. And as such, this too may lead to routine annual vaccination. Now, with more than 75% of Americans vaccinated, experts are hopeful that the country can move toward better control of the disease and toward a new endemic phase, where we can control the disease and it does not control us. Past pandemics have led to massive changes in the way we live, and we've come to accept these as normal. Screens on our doors and windows help keep out mosquitoes that carried yellow fever and malaria. Sewer systems and access to clean water helped eliminate typhoid and cholera epidemics. Perhaps the lessons learned from COVID-19 in terms of disease prevention can yield long-term improvements in individual and global health. While many restrictions have been lifted, hard lessons learned regarding hand washing, social distancing, and other NPIs, non-pharmaceutical interventions, will continue to be beneficial should we experience an infection rate surge. Hybrid testing vaccination sites, such as the Jefferson Community Vitality Center at 32150 Dorsey, remain open till March 31st. No appointments are necessary, and you do not need to be a resident to receive care. Vaccinate Westland continues to monitor community needs and is ready to ramp up mitigation efforts should demand arise. The City of Westland understands that this pandemic has been a challenging, long ordeal, and you may need other help. If you feel like you need crisis counseling or just need to talk with someone, there are mental health resources available. For free, confidential support from a Michigan Stay Well counselor, please dial 1-888-535-6136 and then press 8. This number is available 24/7 and a welcome reminder for everyone to please be kind to your mind. Thank you for your attention and stay safe, Westland.